What's up guys, this is Dr. Kyler with Pro Arm Academy. In this video, we're gonna be talking about the basic positions that I really like to see people in when they get into foot strike. That's really gonna lead them to efficient throwing when it comes to actually sequencing their body in the right manner to, like I said, be more efficient. And what we also call this would be like kinematic sequencing, if you've never heard that term before, right? So I'm gonna hop on the mound here and we're gonna talk through briefly what I'm looking for when it comes to certain positions, especially with like your hips and then your arm at foot strike specifically, because this is almost like the base prerequisite. If we're in a good position, then it's probably gonna lead us into efficient throwing, okay? Now, let's hop on the mound and I'll actually talk through more of this. There are tons of different, what I would call styles to how they actually go through their windup, but we're really looking at a little bit past that, right? So there's different phases of throwing motion. So we're not talking about the windup. We're really not talking too much about the stride phase specifically. We're looking at the phase when you are at foot strike and you are basically getting into this early cocked position of your arm. Now, at foot strike, what I like people to be is about 45 degrees of external rotation, if you will, or foot kind of at a diagonal, right? So if I land right here and it's straight going this way, it's gonna be very, very hard for me to rotate over my front side because of my hip internal rotation here. So we've got to be able to open our foot up a little bit in order to be able to rotate over our front side, okay? Now, everybody's a little bit different when it comes to, how much they're open. Everybody's a little bit different on what they feel comfortable with, and especially when it comes to their hip mobility, right? So when we get into foot strike here, we want to have it open a little bit. I'm saying 45 degrees right now. Our front knee, we actually want that to be around 45 degrees of flexion or knee bend right here. A lot of times guys, we'll see them land on a very soft front side, and that actually gives them a little bit more linear movement this way, and it will throw their mechanics off when they actually throw, and actually increase the risk of injuries as well. So we want to have a solid front side at about 45 degrees of knee flexion here, all right? So that's really front side, okay? When it comes to our arm, what I like to see athletes doing is getting their arm elbow behind their shoulder, right? So I'm not gonna get too technical when it comes to the actual terminology for this, but just know elbow kind of behind your shoulder, right? Keep it back here. And I also should note too, that it's not just pure elbow behind your shoulder. We're actually getting it back because your shoulder blade, or your scapula, okay, it's actually retracted a little bit, right? It's not an active like retraction as if you were to do like a row where you're squeezing your shoulder blades together, but it's more of like a passive thing. When your arm flips up, your shoulder blade is gonna be retracted as you do that, and that's gonna allow you to get your elbow behind your shoulder as well, okay? So that's number one, we wanna go elbow behind the shoulder, okay? Number two is I like to see athletes get to be around 45 degrees of external rotation, okay? So right here, if we kind of consider this neutral, this is 45 degrees, let's turn this way. So 0 here, 45 degrees, 90 degrees would be straight up and down. So you can see how that's a 90-degree angle right here. Somewhere right in the middle, 45 to 50. Some people will get up to like 55, 60 degrees. The biggest thing I don't want to see people is at foot strike, your arm to be like dumped forward, right? With their elbow up in the air. That's gonna have them to have essentially a late arm action. So when they do sequence their body, they're gonna have to accelerate their arm significantly faster, putting them at risk for injury because they're basically, late with their arm, right? So there's two extremes. I don't want people to be really dumped forward, and I don't want people to be flipped up too early as well. That would be the opposite. So a foot strike, I wanna be somewhere in the middle right here, right? So that'll be very important when it comes to efficiency of transferring into layback as you actually sequence the throw, right? So that'll be number two. The third thing that I'm kind of looking for is to have a good, almost like counter rotation with your trunk, okay? So what I mean by that is at foot strike, you should be kind of, rotated a little bit back with your trunk. What that's gonna do is allow you to already preset some tension in your core. So if I come here at foot strike, I'm not open up with my pelvis yet. I'm not rotating yet, but I'm also not straight in a line, pelvis facing this way, trunk 100% facing this way. My trunk is a little bit rotated back. That's gonna help when we get into the sequencing aspect, and especially when we start to actually initiate that movement down the mound, right? So those are some basics when it comes to certain positions that I'm looking for. Like I said, just the basics. There's a lot more to this stuff, but just the basics to start out, okay? Now, when we talk about sequencing or the kinematic sequence, you can get really, really technical when it comes to actually graphing all this stuff out with like motion capture, and you might have seen people like put little dots all over their body to actually have cameras pick up on their body movements and things like that. Some really high-tech stuff. A lot of people are doing some different research with mocap, and especially like elite level players that are getting this stuff to really dial in the mechanics, and definitely needed for sure. But I feel like a lot of times at the youth level, obviously that's not gonna be as readily accessible because, you know, motion captures are typically, you know, $50,000 to $100,000, right? So it takes a little bit of money to be able to invest in something like that. And most athletes just don't have access to that with, you know, your normal everyday pitching coach, obviously. So when it comes to the kinematic sequence though, what we can do is obviously just use your phones, right? We can get some video of people actually throwing. What I like to do is get videos from a few different directions. So I will actually get video, like stand behind somebody, go video down the line, and then also get video from kind of a face-on view. So if I was throwing this way, somebody would be standing in front of me essentially, right? So I get two different views just so I can see different angles. But when we talk about kinematic sequencing, really what I'm looking at is, or the definition of kinematic sequencing is essentially just the efficiency of throwing, right? I want to see certain body segments move first, and then another one move next, and then another one and another one, right? And so I like to look at, or really break it down when I talk to like parents and coaches and athletes, really 4 different segments, right? We've got our pelvis, we've got our trunk, we've got our arm, and then the ball in the hand, right? And so when we actually go in sequence, quote unquote, the actual throw, at foot strike, like we'll go through our wind up, we'll get a stride, we're in this good position like I talked about. What I like to see first is I want to see your pelvis rotate first, right? So we're going to see this kind of movement happen. This is kind of the motion that I'm looking for, right? I want to see, can the athlete disassociate their hips from their torso, okay? When we do that, that's going to allow us to build energy in our core and then allow us to have very good efficient throwing, okay? Even actually before that, I would say it really starts with your hip internal rotation. So what we're going to see is your hip. And I don't necessarily like the term like knee diving in. I don't know if that's the right term for it. I've heard some people talk about it that way, but essentially your back hip is going to rotate in, and that's gonna kick your pelvis to rotate towards home plate, right? So you can almost see this kicking in first and then allowing that to rotate your pelvis. And then after that, we're gonna talk about our trunk, right? So our pelvis is gonna rotate, and then we're gonna still have that counter rotation, but our trunk now is gonna be the next segment to rotate towards home plate, okay? So we're gonna get pelvis, we're gonna get pelvis, trunk, and that's gonna allow us to transition into layback here. And that's our next segment, which is our arm. And our arm is gonna lay back and then unravel. And then the hand and the ball is that next segment that's actually going to deliver the throw, right? So I'm not gonna do like a full speed pitch here, but walking through your wind up, right? Stride to get in a good position here. We should see knee kind of kick down to go into internal rotation with our hip. Our pelvis is going to rotate, which is gonna keep our trunk counter rotated here. And then as we pull with our glove side, what that's gonna do is allow us to then transition our torso and then drop into layback here. And then as we get our, knee kicking back, that's gonna allow us to really generate that efficient throwing motion that you'll see, obviously. A few things that we talked about here. Like I said, just positions that I like to see athletes in when they get to foot strike, and then also just the basics of kinematic sequencing. Like I said, that can be a pretty complex topic, but nonetheless, really important for really every coach and athlete to know in order to make sure that you're doing the right things to improve your mechanics, improve your performance. And so this also allows us to specifically prescribe certain throwing drills in order to make sure that athletes are actually working on the things they need to work on to move the needle forward with their performance. So All right, hope that helped with a couple of these topics, and we'll see you guys in the next video. Thanks.